Hi, my name is Rajiv.
Hi, my name is Maitri and this is our 2 days old unnamed baby. We are here to share our experience of our Dr. Manjula S Patil. I reached motherhood towards the end of my 7th month because of some complications in my pregnancy. The previous hospital informed us that they will deliver the baby prematurely. I was 28 weeks pregnant and I was feeling very low. I did not want the baby to be so early delivered and consulted Dr. Manjula S Patil. She really explained us the process of the complications we were going through and what all it takes to deliver the baby. She calmed us down and she helped us in reaching from 28 weeks to 39 weeks, and though it seemed impossible to have a baby without operation, I delivered the baby in very normal situation and it's a normal delivery. We are very happy with the experience that we had. The staff is really helpful. The nurses and the doctors, everyone helped us a lot in making this experience beautiful and journey unforgettable.
When they came to me for the first time, when you have this scenario of fluid around the baby being significantly reduced, what we in medical terminology call it as oligohydramnios, we as consultant, our primary concern would be like to identify what may be the cause behind this oligohydramnios, and second aspect is managing the patient further. So as a part of identifying the cause for this oligohydramnios, I went ahead with complete history taking from the patient if she had any time a history of leak, and then going through all her previous reports, and she was very much up to date with her scan, right from whether it was a NT scan done in the 3rd month and the anomaly scan. So going through all the reports, I got to know that there was no obvious structural defect in the fetus which can cause this reduced fluid around the baby. After that, I just concluded it may be something like an isolated oligohydramnios. Since it was only 28 weeks of pregnancy when she came to me with oligohydramnios, my management basically includes to try to push her pregnancy as far as possible to reach term, that is 37 completed weeks. With a reduced fluid around the baby, we do encounter some of the complications, like baby can have a fetal growth restriction or the reduced growth of the baby, or there can be chances of baby passing meconium, distress that develops, and then very rarely there can be possibility of sudden intrauterine fetal death. Because of the preterm nature and the oligohydramnios, this particular pregnancy required a very close follow-up, mainly in terms of monitoring the fluid around the baby and then checking how the baby is growing further. So I completely counseled the couple at that point of time regarding what will be my approach going forward. Close follow-up with ultrasound, checking the fluid around the baby, which I monitored like once every 1 to 2 weeks, and even studying the blood flow to the baby with an interval of 1 to 2 weeks, and then doing a growth scan once every 2 to 3 weeks. The couple are very much understanding kind. They knew the importance of that, and then they were very much adherent to whatever I advised to the couple. Not even a moment they just doubted my decision regarding doing any investigations. So with this continuous monitoring, we could successfully get a pregnancy to a term, that is 37 completed weeks, when I just planned for induction of labor, that is artificially stimulating the labor contraction. Since we will be very closely monitoring them throughout the process of labor, in case of fetal distress we will be able to identify them at the earliest, and then we will be able to go ahead with cesarean section at that point of time. So all these babies per se are not directly the indication for going ahead with the cesarean section. So similarly, even I just went ahead with inducing labor pain for Maitri, and then luckily we did have a successful vaginal delivery of a healthy baby, and at the end of it, it was a healthy baby and a healthy mother. And I would like to congratulate the Gyne couples for being so adherent to treatment and then following my instructions very clearly, and for the great cooperation they gave me throughout monitoring the baby and then having a successful vaginal delivery. Thank you.
And Dr. Manjula S Patil, I want to give her a special thanks because she was there and helping me in every step I have faced through this pregnancy.